Okay, I think we're going to try to get started. It's time for us to begin. So if you could please take your seats. That worked really well. Yes. You know, I asked Amy about that. She said because everybody has a hard time seeing the slides that... Oh, that's true. Okay, so maybe we should have... Yeah, so let's see. It's you, George, Nick. Do you want to come up to the... So our rapporteurs are coming up to the table, and we're going to go ahead and begin the program. And in this segment, what we're hoping to accomplish is to... are you able to hear in the back? Everybody hearing okay? Okay. Is what we want to try to accomplish is sort of a readout of what happened during the breakout sessions. We're going to try to take about 10 minutes, have each rapporteur spend about 10 minutes discussing the readout from their group, followed by a 20-minute discussion to explore action items for future developments with the goal of wrapping up by around 2:15. So with that, let's begin with Group 1. George, if I could ask you to come up and tell us what happened in your segment. Or actually, you could just sit right there at the table if you'd prefer and just turn on your mic. Group 1. So they actually have slides? That's great.
Thanks. I'm George Miller from Altarum Institute. I was in the first of the 4 working groups that was looking at issues related to, I guess, health behaviors.
Mic's not on.
It is on. Oh, I'm just not close enough to it, I guess. I'm sorry. Karen, our leader, was kind enough to provide a couple of graphical pieces of material which our scribes took down, and they have become the 2 graphs that I'm going to use here, although I won't talk about them in great detail. This first one is a value per effort graph created, I guess, originally by Barry Richmond, and indicates that the more complex the modeling becomes, starting with just good conversational use of skills and going up through very complex modeling, obviously the more effort or time is required to produce them, and to some extent the more value is derived. But if you see over to the right, the mother of all models there, the curve actually declines some as you put more effort and time into the model, because I think partly because models that become so complex that you can't understand what they're doing don't provide the value that models, I think, should be providing, which is to help educate your insight rather than simply to provide numbers. The next slide actually is also a list of guiding principles, again, that Karen was kind enough to put up at the beginning of our session in order, I think, to stimulate the discussion. And I think they're kind of a useful set of principles associated with not just modeling, but with modelers working with decision makers. So you would like a model's purpose to be clearly identified and supported by the client. Developed in a collaborative process, I think, is very important. I believe that for models to be appropriate and accepted, you need to have a collaboration between the modeler and the stakeholders, and I guess Louise would also add subject matter experts involved in the entire process. Obviously, that will improve the quality of the model. It will make it more relevant to the decision maker, and importantly, it, I think, is more likely to be accepted by a stakeholder who has been a part of the model development process than someone to whom the model is brought after it's been developed. As simple as possible, but no simpler. I think inappropriately attributed to Einstein, that statement, is related to the previous chart in which we saw the quality, the value of a model declining as it becomes so complex it may be difficult to use. Tailored to the readiness and levels of engagement of participants. There was some point made in our session to the effect that sometimes you don't need a model. There's strong empirical evidence for a decision. The decision makers are on board. But there are other times where you have perhaps a lot of information about a potential intervention, but that information needs to be organized and coordinated in a way that the various people who are thinking about it get the same mental model of how all that information interacts, and that's when modeling can be useful. Modelers have to have the right skills and used as part of a larger change process are also part of her guiding principles. There was a lot of talk in our session about acceptance by the decision maker, and one of the points made was that if model results are understandable and people believe their outcomes, people are more likely to believe the models. I guess that's sort of obvious, but also goes a little bit against what I think of as one of the important values of a model is insight education. That is, if the model simply tells you what you think you already know, it hasn't done a whole lot to contribute to decision making, although it might be useful in supporting a decision that one would like to, or supporting an intervention one would like to follow. So there's, I think, a trade-off between making sure that the results are understandable, but also having a model that has the richness that it hopes that allows you to hope that it will provide you some new knowledge as well. In that regard, there was some discussion about the fact that modelers need to know how to talk to and translate the results of their modeling to stakeholders, to decision makers, and to understand their needs. There has to be a good communication process there, and that I think is partly related to modeling helping to improve your insights, but also at the front end building a model that is more effective. In that regard, also solving the right problem is important. Somebody mentioned for example, that if a model simply shows what an intervention will do to changing a risk factor where the decision maker really would like to know the economic impact of that change, then the model hasn't gone far enough to perhaps to support the decision. We also had one other point about acceptance by the decision makers. There was a point made that we need models that can show decision makers how to trade off interventions in different sectors, and that's particularly true, I think, in the upstream kinds of population health interventions that some of these groups are talking about, partly because trading off, that's what legislators have to do, trade off interventions or investments in different sectors, health, education, transportation, for example, but also because those investments will interact to affect population health in complex ways that we need to understand better. We had some discussion about timing and the fact that I think Bobby said earlier this morning there is this interest and importance in understanding the longer-term impacts of some of these of interventions, and I think that's particularly true in population health, where much of the value you achieve from these interventions are in the long term. But there is, on the other hand, for decision makers, a trade-off between long-term and short-term concerns. Legislators, for example, have to worry about budget cycles and therefore tend to have a short-term focus. And also there was some discussion of the fact that models tend to discount the future appropriately because we don't understand the future as well as we understand the distant future as well as we understand the near future. But through use of, because of uncertainty, because of treatment of, discounting the time value of money, even though the future may be where the value of some of these interventions lie, models tend to discount that to some extent, and that's, again, a kind of a dichotomy or trade-off that we have to think about. On the other hand, somebody raised the anecdote of a legislator recently who used model results to provide the courage to make a recommendation for a long-term investment that might not otherwise have been made in the context of having to worry all the time about short-term budgets. But the model provided the evidence that allowed this legislator to go forward with that recommendation. There was also a little bit of talk about, with regard to diabetes prevention and the where in the cycle of the development of diabetes the intervention should occur, and what modeling did in this particular case was help to frame the question properly, that we shouldn't be addressing the problem with pre-diabetics. We should be going farther upstream than that, so that modeling did help you to think about longer-term impacts appropriately in that kind of context. I apologize to my other panelists for all the important things I left out, but we didn't have much time to organize these.